Hey everybody, back once again, Saturday mornings, 9 a.m. Really good to see everybody. So first big announcement, we started this out as a stretching program every Saturday, and based on comments and requests, it's evolving, and I spoke with my producer, and now we're going to switch this over from stretch Saturdays to self-care Saturdays. First thing we need to do is make sure we get a marker that works properly. So we'll try a different color. Pink is out. I bet none of these are right. We'll go with blue. That's my producer's least favorite color. Yep. Okay. I'm going to hand these markers back over to the producer, and she'll get me one that works properly. Alright, so we will now be holding self-care Saturdays, and the reason that we switched that over is simply because there's so much more that I can share with you guys besides stretching. Look at that. I think this one's got coronavirus. Alright, you'll just have to take my word for it. Self-care Saturdays. Last week we got a request to dive into neck or back pain. So that got me thinking, what can I share with you in 30 minutes that would help alleviate neck or back pain? And neck and back pain can be so specific as far as the diagnosis that's actually causing the problem. So I figured I'd actually start from the head down, and we'll go along with what a lot of people are dealing with, a lot of the stress, whether it's emotional or physical or psychological stress. So that can manifest itself in a lot of ways, but one of the common ways that stress will affect you, that you can actually do some self-care strategies at home and alleviate some neck pain, is going to start with the head, neck, and face. And the big three muscles we'll focus on today are your trapezius, right on the top of the shoulders and the top of the back, your masseter here in your jaw, and your temporalis here on the side of your head. So a lot of times when we feel the weight of the shoulders is on us, we'll flex our shoulders up, and that'll create some trigger points and tension in the trapezius muscle. That in turn will actually create some trigger points in the jaw and in the temporalis muscles. So a lot of times when you're out on the road and you're driving and somebody cuts you off, you might scream profanities or clench your jaw, bite your tongue. These are all signs that you're dealing with stress and you're just internalizing it. Here in your face, every time you talk, chew, grit your teeth at night, maybe you grind your teeth while you sleep, you're going to activate these two muscles, the masseter and the temporalis. So I figure we start there because the way that you hold your jaw impacts the way that your neck is. And what you'll feel is as your shoulders and your head and your jaw start to relax, your neck actually relaxes as a byproduct. And then the two tools that we're going to use besides our hands, I have a trigger point ball here, and if you don't have a trigger point ball, that's okay. These are just a little bit more comfortable to use than, say, a lacrosse ball. You could use a lacrosse ball, you can use a tennis ball. If your dog has a ball, you could use that. You might want to wash it off, and you might want to not let your dog see that you're using it, because the dog won't leave you alone, because he thinks it's time to play. And then this is one of my favorite things, a Theracane. These comes in all different shapes and sizes. This one's actually almost 20 years old. I got this when I was graduating massage school. Been around for a while. You can pick them up on Amazon, but they're great for those hard to reach places. So and then you strengthen, and the reason that you do that is you want to get the muscle to calm down, then you want to stretch it and reset it to the normal resting length, and then you would begin to strengthen it. And the reason that you do that is because if you're strengthening a muscle that is dysfunctional. So it has a knot in it, or it's not at a normal resting length, so it's either contracted or it's too lax. What happens when you strengthen that is you strengthen a dysfunctional movement pattern, and it makes it harder and harder and harder to get it to go back to the way that it needs to be. So we're going to start with massage, and then we'll do some simple stretches, and then you guys can strengthen your muscles over the weekend. Okay, so first one I want to work on is the temporalis here on the side of the head, and the temporalis is shaped kind of like a sand dollar. So we start on the right side of the head, and you can feel your cheekbone right here, and just start to travel, walk your fingers up in front of the ear. You're actually going to follow the tendon of the temporalis, and just above the ear you can start to feel some tissue. You got some right in front of the ear. You'll start to find some tissue there, and you can just start to circle around with some digital pressure. And I say digital pressure, I'm just using the pads of my fingertips. And you can go forward, you can go backwards. And again, that muscle is shaped like a sand dollar, so you can use all 5 digits of your hand, and you're just moving your scalp up and over the tissue. Careful not to pull your hair. And you're looking for little nodules that are present in the temporalis. And then when you find one, so I have a little nodule right there, completely common to find a little nodule in your head, you just hold digital pressure on it. And you can just hold the pressure there for count of 10, 20, all the way up to 60 seconds. But what you want to do is at about the 10 or 15 second mark, maybe even 20 seconds, you let go of some of your pressure. And what's going to happen is fresh oxygenated blood is going to come rushing in after you just pressed out all the metabolic waste that was stuck in that muscle. So when there's a contraction over time, metabolic waste gets stuck in the muscular tissue, the blood becomes stagnant, and the muscle has a hard time turning off. So the muscle gets angry because it's not sleeping, just like you and I. If we don't get enough rest, we get angry. So you go and press on it. It might be a little sore. You might feel referral pains shoot around the scalp, maybe even down into the jaw. Totally common. That's not a problem. You let go, the fresh blood comes in, and then you're going to press on that same spot again. Again, you're going to press for 10, 15, 20 seconds, all the way up to a minute. There's no specific recipe. Older literature would say 20, 30 seconds per press, or up to a minute. And then the newer literature says 8 to 12 seconds. Just do what you can with what you got. And then let go. And usually by the 3rd time you press on it, you can really tell, wow, the tissue is less dense, it's a little softer, it's harder to find the ridges of that little nodule you were pressing on, and it's not as sensitive. You might not feel the referral sensation as much. So I'm going to press on it one more time, and I can tell the ridges of that nodule are harder to find, so now I'm kind of searching for it. I'm moving my hand around a little bit more, finding the ridges of that nodule, and I'm going to actually press from a different angle, and I can feel it moving in a different pattern now. This is the neat thing with trigger points is, depending on the angle that you press on the trigger point around the nodule, it's going to give you a completely different sensation. Since we're going to do several muscles, I'm going to just recommend find the worst spot in each muscle and just focus on that one for today. And then as it releases, we'll move on to the next spot. So I'm done with that side. I'm going to let you do the left side on your own, okay? Now we're going to move down into the masseter. Now the masseter actually travels kind of at an angle down the side of the cheek. So if you just take your finger pads, go right under the cheekbone, and swipe down to the bottom of the jaw. So that's basically the pattern that the striations in the muscles follow for your masseter. Now what you want to do is open your jaw, and it's going to relax the masseter. So literally opening the jaw relaxes the masseter, and then you can swipe down. And you're looking for a nodule. You're looking for a nice big knot right in the masseter. If maybe swiping down doesn't do it, you can start to do a little circular friction, nice and slow. And what you're doing is, because the fibers go this way, as you do a circle, you're going across the fibers. And that's really going to help you pick up on where that nodule is. So I have one right there. I'm going to hold my jaw open. And I'm just pressing in. And you want to press, again, 10, 15, 20 seconds at a pop, maybe even all the way up to a minute if you can deal with it. And you're pressing out that metabolic waste, all that stagnant blood, and then go ahead and let go, and you're gonna allow the fresh oxygenated blood to rush in. Give it a good 10 seconds. Don't move from that spot, just release the pressure, and then once the count of 10 is gone, you're gonna press back into that spot. Again, looking for that sensitivity. Now that's not the only jaw that the only muscle that affects the jaw, but that's the big one we're going to focus on today. Right in there, and again you can go across the grain. You're just really looking for the worst one. It's a great thing to do right before you go to bed too. It'll help relax all the tension that you've built up in your face throughout the day, help you sleep at night, help you fall asleep, stay asleep. Alright, so here we worked on the masseter, we worked on the temporalis, now the trapezius. So if you don't have the Theracane, you can simply just use your hands, and you can press into that upper tissue right above the shoulder there. And again, move in a circular pattern, use all the fingertips, look for that big knot, the thing that really pokes its ugly head out at you, and you can put digital pressure right on it. And you may feel it refer up the back of your neck, into your temple, or into your jaw, because it'll light up that whole side of your neck and face. Now, if you have any of these devices, Theracane allows you to very easily find knots and trigger points in the trapezius. As you can see, I'm just leveraging pressure down on these little handles, and it's putting pressure on the little knob right on top of my shoulder, and I can just sit right on that spot. And there I can feel that going up the back of my neck and into my ear. Same rules apply. You're going to hold there for 10, 15, 20 seconds. You can actually move a little bit, do some pin and stretch techniques. I'm pinning the tissue down, and I can just move my neck to the side, really stretch that tissue out, and then let go and allow that fresh blood to come back into the trapezius, okay? If you do have the trigger point ball, you can actually use that on the side of your head. In your temporalis muscle. Works really good. Nice. If you want to add additional pressure, you can put one hand over the other. Same thing with your jaw. You can take that little trigger point ball, go into your jaw. And then lastly, you can actually lay on this. So if you were to lay on your floor, you can put this little ball right there on top of the shoulder, in between the shoulders. Now you will affect some other muscle groups besides the trapezius, but the trapezius is the most superficial. If you don't want to lay on it, you can simply use the wall. One of the really neat things you can do is just take a sock, maybe a tube sock, put the ball in the tube sock and throw the tube sock over your shoulder, and then you can regulate how high or low the ball falls, and you can just lean up against a door. All right, if anybody is on the call or the Facebook Live with us today, go ahead and chime in, let us know that you're there. If you have any questions, go ahead and type them in. My producer will get the questions over to me and I will answer them the best that I can. So now we just massaged the muscles, and I'm going to let you guys do the left side at home. We're just going to do the right side today. Now we want to stretch some of those muscles out. Let's go ahead and start with the big guy. We'll go ahead and start with the trapezius. So a couple different ways we can stretch the trapezius, because it attaches right up to the base of the skull here, comes up off the shoulder. One of the easiest ones is going to be to bring your hands behind your head and then sink your chin down. This will do both the left and right trapezius at the same time. Very simple stretch. Keep your elbows in, bringing the chin down towards the chest. Probably feel it right at the base of your skull, going down the neck, maybe even into the shoulders. And then if you tilt your head to the left, with your left hand over the back of your head, you can begin to pull your head down towards the left side of your chest. And then with the right hand, reach towards the ground, so you're depressing the right shoulder. And then finally, if you rotate your head to the right, tilt your left ear at the ground, and depress your right shoulder. You'll stretch all different fibers of that trapezius muscle. Now you can also do what's called a contract relax stretch. That's one of my favorite types of stretching. What we're doing there is we're taking the muscle to its end range, so as far as it can go comfortably, and then we're going to contract while we inhale in. When you contract against resistance, the muscle's going to broaden, and it's going to reset the little receptors in the muscle, and then as you exhale, you're going to sink further into the stretch, and those little receptors will lengthen, and they'll find new receptor sites that go up into the muscle when you contract again. So basically, you broaden the muscle, exhale, stretch, broaden the muscle, exhale, stretch, broaden the muscle, exhale, stretch. You can do that 3 to 5 times. So we'll go ahead and do it right here for that first trapezius stretch. We'll do a contract relax. So I'm going to, again, put my hands over the back of my head, bring my elbows in, inhale, exhale, bring the chin down towards the chest. So there's my end range. And now I'm going to inhale and push my head back into my resistance barrier, which is my hands. 2, 3, 4, 5, exhale, and then bring my chin further down. And then inhale again. Notice my head's not moving. And then exhale and relax, sink further into the stretch. Inhale. And exhale. Now, if you have any pre-existing conditions, obviously you need to listen to your body. If anything feels a little too uncomfortable, don't push it. It's not a competition. You're trying to do something nice for your body. All right, jaw stretches. These are really awesome. I subscribe to these. I do these a lot. I do tend to hold a lot of tension in my head and my face. So we're going to do that contract relax stretching, just like we did for the trapezius, but we'll do it for the masseter, and then we'll also be hitting some of the inner muscles that we're not working on today, the pterygoids, which typically you work by putting a glove on and going in your mouth and massaging inside the cheek. Super effective for TMJ dysfunction. It's one of the things we do at my clinic. So for the stretch, what you're going to do is open your jaw. With your hands, you're going to place your fingers and thumbs around your chin, or you can use the web of your hand and put it right around your chin. And you need to drop your chin all the way open as far as it'll go. Like that. Are you gonna look funny doing this? Yes. Alright. So open your jaw all the way, hand across the chin. You can even stabilize your forehead if you like. And then what you want to do is contract against your resistance of your hand. And you're just doing it enough to engage these muscles in the side of your jaw. So you're not trying to overpower yourself. All you're simply doing is activating that muscle to make the muscle broaden. And then you're going to inhale for 5 seconds while you're contracting. Then you'll exhale and gently open the jaw more. So you're going to broaden by contracting, and then exhale, and then lengthen by opening the jaw more. So we'll do that 3 times. Ooh, I did it 4 times. I actually had saliva starting to come out of my mouth, so I had to stop there. I could feel a lot of tension right there on the right hand side. Completely normal. That's the side that I carry all the tension on. That's usually where my jaw clicks and pops and stuff like that. Again, just listen to your body. You're not trying to exacerbate any pre-existing conditions. We're just lengthening tissue. So we got a question from Terry regarding the cervical stretches. Is it safe or unsafe if you have any bulging discs in your neck? So bulging discs can actually be at different stages. So regarding a bulge or a herniated disc, a bulge is simply where the disc is starting to protrude out, either the side, the front, or the back. It could be putting pressure on the nerve, or maybe it's not putting pressure on the nerve, but now the vertebrae is putting pressure on the nerve. And then the worst case scenario is when the bulge actually herniates and the nucleus pulposus inside actually ruptures. A partial herniation is where the disc still has a little bit of integrity, and a full herniation is where the nucleus pulposus is now outside the disc and you've lost the integrity of the disc. Is it safe? So it really depends on where you are on that spectrum. Typically, when you have a herniated or bulging disc, there are specific movements that are going to increase pain, and that's because it's increasing the bulge. So again, I'm going to go back to my original statement. You have to listen to your body, and simply because I'm not there with you and I'm not regulating your movements, you know what hurts you and you know what's safe for you. Start small, start gentle. All you want to do is feel a stretch. Don't focus so much on increasing a ton of range of motion, but just focus on resetting the muscle length. So feel the tension, feel the 10% burning sensation of the stretch. If it gives you any symptoms of the disc bulge, then obviously stop that immediately. But if you're sitting with good posture and you're just doing some light stretching, that's typically indicated. You should be able to stretch your neck, but certainly don't put yourself into a dangerous position that any of your physicians have told you stay away from that. But usually those stretches that we're showing here, done while listening to your body, you should be okay. But certainly, anytime that you feel there's something beyond a stretch, something that's too uncomfortable, just stop doing it immediately. And I think that's in alignment with what every physician tradition says. If something that hurts, don't do it. Good question. And then there was another question. What about if you have the reverse curve in your neck? So just to help with the reverse curve, you actually need to be stretching a lot of the muscles in the front of your neck. So that may benefit more from some more manual therapy, just to go deeper into some of those muscles. And these are endangerment sites, meaning there's a lot of vascular structures and arteries and veins and stuff that you can occlude. So you do want a professional to work in there. So there are some simple techniques that you can do. Usually chiropractors will recommend for the reverse curve to actually roll up a towel and put it under your neck, or you can use some sort of cylindrical device to hang your head backwards. Again, I'm not giving medical advice, but I know that what's commonly prescribed from chiros for the reverse curve. So, they'll do adjustments, they'll do soft tissue manipulation, and they'll typically have you doing something to help bring that curve back to where it needs to be. But these stretches should be relatively safe for all those conditions. We do them every day at my practice, never have any problems. Clearly you're at home doing it yourself, I get it, so you're going to have to just listen to how your body reacts to those things, but they should be safe to try. Just start slow and work your way into it. Couple more stretches for the jaw. Now we're actually going to push the jaw to the side excursion. So what you want to do is open your jaw, push your jaw to the side with your left hand, and then you're going to force your jaw into your resistance. So as you force your jaw into your resistance, you're going to inhale in for 5, and then exhale and push further to the right. And you're not trying to overpower your resistance, you're just trying to get the muscle to activate so that it broadens. That way when you stretch it, it resets. So again, I'm going to open, push my jaw to the side, give my resistance, and then push my jaw into the resistance. As I inhale in, 5 seconds, and then exhale, and I'll push a little further to the right side. Stretch my left side, and I'll quickly do my right. Nice. All right. The last stretch I want to leave you with, this is one of my favorites. Probably the easiest way to do this is going to be in the shower. Your tongue affects the articulation of your jaw because it connects all the way down into your hyoid bone here. So the tongue is like just this big muscle attaching all the way down here into your throat. And what we want to do is stretch the tongue out. I know that sounds really strange. To do that, you're going to use your thumbs, your index, and middle finger. And you're going to clasp the tongue from both sides as far back as you can grab it. I do recommend that once you get it, you don't let go, because your fingers are going to get wet from the saliva, and if you try to re-grab it, it's going to be slippery. It's going to be really hard to hang on to, and you're going to have to dry your fingers off, so try to do it right the first time. What you're looking to do is grab the tongue, push the tongue out, and pull. And when you start to pull the tongue, you're going to feel the burn and stretch of the tongue. And what's really interesting is depending on how far out on the sides of the tongue you grasp, or more towards the middle, if you grab more on the outsides of the tongue, you'll tend to feel it more in your cheeks and in your jaw. If you grab it more towards the middle of the tongue, you'll feel it more into the mouth and down the throat. Usually you can only deal with that for about 60 seconds because it is a burning stretch, but you'll feel the tongue extend further and further and further out. And what you're trying to do is relax it enough to where it lies flat on the bottom palate of your mouth. A lot of people are tongue pushers. It's a common thing. You push your tongue up against the roof of your mouth, or you push it against the back of your teeth, or you bite your tongue, or you do all these habits with your tongue. You're trying to get it to relax. If you do this right before you go to sleep, it'll really, really help you relax and fall asleep. Okay, so I'm going to get a little bit closer. I'm going to stick my tongue out, and I'm going to just go for about 30 to 60 seconds, as long as I can deal with it. But again, breathing is really, really important. You're trying to relax your nervous system and feel the stretch. Okay, so here we go. Burn. Oh, wow. I can feel that right behind my ears, all under my jaw, all the way down into my throat, and then even a little bit into my forehead. But yeah, I can definitely feel my tongue just kind of laying flat, like it's just relaxed on the bottom palate of my mouth, like it normally is not, which is a nice sensation. So those are all great massage and stretching techniques that you can do on your head, face, and shoulders to relax tension that you build up over time that actually does impact the neck. And you know, obviously if you're stressed out and you're hanging on to all that stress, it makes you less pleasant to be around, and nobody likes that. So I hope you enjoyed our version of Self-Care Saturdays. Remember, if you don't already, like the Facebook page, like us on Instagram. You'll get notified every time we go live. We'll be here next Saturday and hopefully every Saturday after things go well, 9 to 9:30. Subscribe to the YouTube channel. You'll be able to go ahead and replay all these things. If you know somebody who this would help, you can tag them, you can share the video. You can even share the video to your page, tag them on your page. You can do lots of stuff to include other people in your community who you think that this would be a good idea for them to participate in. Other than that, if you want more individualized attention, message me through Facebook, or you can reach out to me at my office, 727-786-1110. We got a really neat answering system. If you just leave a message, you'll get a text message right away, and we'll start communication that way. We can schedule a 20-minute Zoom call, see what you're dealing with, see if it is something I think that I can help you with, and if it is, we'll schedule a couple of meetings over Zoom, and I'll show you some techniques and tips and tricks to go ahead and take care of that at home while we're all stuck inside. Other than that, I hope you guys stay safe and stay active. Remember to feel, move, and live better. Thanks again. Bye-bye.